CBS 3 Eyewitness News at 11.
An I-team investigation that every woman needs to see.
I would have rather lost a hand than had my face like this for the last 2 years.
They are women who spent hundreds, sometimes thousands of dollars to look years younger. Now the I-Team's Jim Osmond reveals how they're facing the pain after a beauty treatment went terribly wrong. That's next. Plus, it is a cosmetic treatment billed as a quick lunchtime procedure with little to no downtime, and it promises to make women look younger. But some women say they spent thousands of dollars on the beauty treatments, which they say made them downright ugly. The CBS 3 I-Team's Jim Osmond tonight reveals the women who are now facing the pain.
It's any woman's nightmare, paying for a beauty treatment that instead ruins your looks. This look will turn heads, but not in a good way.
It's totally disfiguring. You can't leave the house.
This is what Christine Haney's face looked like after she paid $900 for a laser procedure called Fraxel. Fraxel is marketed as a safe skin treatment that removes years from your appearance and without the risk of other procedures.
The first 3 days, my face was as huge as a balloon, and I was panicked, but I was assured everything's going to be fine.
But she'd have to endure her new unflattering look for 7 long months.
You cry, and then you feel guilty for crying because you feel vain, and then you cry about that. It was not a good time.
The doctor who performed Fraxel on her footed the bill to repair Christine's skin. She still has issues with skin pigmentation almost a year after the procedure.
To me, my eyes go to that. That's the first thing I see all the time. When I look in the mirror, I see the imperfections.
Christine blames Fraxel's marketing, the little risk, little downtime pitch, as the reason why she agreed to try the procedure.
It's misleading.
We heard the pitch when the CBS 3 I-Team went undercover to an office in Cherry Hill where they offer the procedure. The woman we spoke to is not a doctor.
No risk at all whatsoever. I mean, you know, if anything, it's great for your skin. It does everything for your skin. You're definitely a candidate.
Problem is, a medical doctor at a Marlton clinic told the same producer on the same day, because of her skin type, Fraxel could harm her.
From you don't recommend Fraxel. That is not the best option for what you're looking for.
My skin now looks worse than my 60-year-old mother's.
Angela Walker wishes her doctor had told her that. This is what she looked like before Fraxel, and here's what she looked like after the procedure was done 2 years ago.
My face looks probably 15 years older now. I have, wrinkles. It looks like I had acne scars.
It's rare for Angela to leave the house these days except to walk her dog. She's that embarrassed by her looks.
I would have rather lost a hand than had my face like this for the last 2 years.
It's not clear why these women's skin reacted the way it did or if human error was involved in performing the procedure. Dermatologist Dr. Vicky Cirillo Highland of Bryn Mawr Hospital says Fraxel has been effective on a number of patients, but the patient has to be a good candidate for the procedure, and a qualified doctor needs to perform it.
People have to ask more questions of their physicians, know where they trained, know what kind of physician are they, how long have they been in practice, how many procedures have they done, what side effects have they seen, and if these should occur, how do you treat them?
Christine and Angela thought they had done their homework, but now they're determined to warn other women.
That was the biggest mistake I feel like I've ever made.
It's ruined my life.
Solta Medical, the parent company of Fraxel, sent us a statement. It says the procedure has delivered, quote, safe results in over 500,000 treatments worldwide and has, quote, safety features that produce effective results with minimal recovery time. Solta would not comment about the women from our story, but said it notifies the FDA of all reportable events. The company did not respond to our questions about marketing for Fraxel, but encourages doctors to discuss the risks and potential side effects with patients. Meantime, the women have contacted the FDA, which says it will look into their claims regarding the marketing. Susan and Chris?
So we're talking 2 women here, but all told, about how many women have been so affected they've contacted the FDA.
Since the procedure has started, and remember, this is contacting a bureaucracy. There have been a dozen complaints to the FDA, but we have found dozens on the internet. There are many more, but balanced and fair reporting. Some women say they've seen benefits, some have not.
Not effective results for all women.
Not all
the bottom
women.
line.
Yep.
All right,
Thank you.
Jim Osmond, thanks.